Fortunately, doctors, and she means medical doctors, can only have X amount of patients who don't do the jabs, vaccinations, because of insurance reasons, and that is true.
So it stands within reason that if you're wondering about a medical doctor's job, then maybe you should ask a medical doctor, not a chiropractor, especially one that hides his degree and you have to hunt to find what his credentials are. Speaking as an actual medical doctor who does give vaccinations out in their clinic, I receive $0. I get no incentive for giving out vaccinations in clinic. On the same vein, can I only have a certain number of people that don't do vaccinations because of insurance reasons? No, it always becomes a patient-centered discussion with the patient to determine what they think is right for them alongside an actual patient-physician discussion, not whatever garbage this guy is saying completely out of nowhere.
And Big Pharma wants everyone vaccinated, period, multiple times. So they just keep coming up with new vaccinations you've never heard of.
Even that statement highlights how little you know about vaccines. It also doesn't matter how long you've been practicing if you're still wrong. Let's take polio, for example. Polio is a vaccine series you get as a kid. It's 4 shots and then never again for the rest of your life. You can even look at the reported polio cases, the cyclical movement, and then when the vaccine came out, it dropped and stayed low. Or measles, a 2-dose series you get as a kid, and then again, never again. You can see all the reported cases, then when the vaccine came out, it dropped, and when the second dose was recommended, it dropped even lower to the point where it was considered eliminated in 2000. And then you have conspiracy theorists and naysayers saying, actually, it's not safe based off nothing. And now the United States has lost their measles elimination status, thanks to people like the creator.
It's true. Look, medical doctors love money.
Then a baseless accusation with no other purpose than to further the mistrust a patient may have with the medical system. Not only is this type of wording uneducated, it's disgusting. Don't get scammed. Take back your health.